COVID-19 spread and how to prevent. What is COVID-19? First, before the video starts, the audience target for this video is the public, Malaysian and worldwide. Coronavirus disease or COVID-19 is an infection disease caused by a newly discovered coronavirus. Most people infected with the COVID-19 first will experience mild to moderate respiratory illness and recover without recurrent special treatment. Older people and those with underlying medical problems like cardiovascular disease, diabetes, chronic respiratory disease, and cancer are more likely to develop serious illness. The COVID-19 virus spread primarily through droplets or saliva or discharge from the nose when an infected person coughs or sneezes. So it's important that you also practice respiratory etiquette, for example by coughing into a flexible. At this time, there are no specific vaccines or treatment for COVID-19. However, there are many ongoing clinical trials evaluating potential treatments. World Health Organization will continue to provide updated information as soon as clinical findings become available. So, how do you get COVID-19? A person can contract COVID-19 if they come in contact with another person infected with the virus, someone infected or sneezed directly to them, and they touch and interfere with little droplets from infected people's cough or sneeze and then touch their ears, nose, or mouth. So, evaluation of the amount of cases. Evaluation of confirmed COVID-19 cases in the world are shown below. So, as today, there are 3,139,523 total cases of COVID-19 as of April 2020. And these are the number of recovered cases and the dead case.
What Malaysian government has done. After being satisfied that all states and federal territories in Malaysia are threatened with an epidemic of COVID-19, the government has decided to implement Movement Control Order. It is commonly referred to as the MCO. MCO refers to the Prevention and Control of Infectious Diseases Order 2020, which was issued by the Prime Minister Tan Sri Muhyiddin Yassin on 16th of March. The Phase 1 of MCO began on 18th of March until 31st of March. It controls movements and gatherings as follows. Firstly, public is not allowed to travel within Malaysia unless for specified purposes like official duty, essential services, food or daily necessities, or healthcare or medical services. Gathering was banned whether for religious, sports, recreational, social, or cultural purposes. Attendees of funeral ceremony must kept to the minimum. And lastly, public is not allowed to travel within Malaysia without prior written permission of a police officer. Essential services that were allowed during Phase 1 are listed as follows. The Prime Minister later on announced an extension of MCO to Phase 2. It separates the regulations to control movement and gathering respectively, with each having tighter restrictions. A 10 km travel restriction was imposed with leeway given. Secondly, no passengers allowed in vehicles except for emergencies. Hypermarkets, grocery stores, and petrol stations, meanwhile, were only allowed to operate from 8 a.m. to 8 p.m. Schools would continue to be closed. PCID regulations too reduced the number of essential services from 22 to 10 as listed below. The MCO Phase 3 was being reasoned by allowing several more economic sectors to operate. Hardware shops, electrical and electronic shops, full-service laundry shops, barber shops are now allowed. Police enforced stricter rules against those who violated the MCO. They will be arrested immediately and charged in court. And offenders who were found guilty can be jailed. The MCO has now entered its fourth phase, with the country now in a stage of recovery from the outbreak. The government is now allowing 2 people from a family to run errands. Travel limit of 10 km radius is now possible to be extended further, and some university students in hostels is allowed to return home. The proactive and aggressive steps of the government in curbing the spread of the disease have resulted in a flattening of the curve, It is a joint success of the people and the government, so let's keep on contributing full commitment to complying with the MCO.
Timeline and result of MCO in Malaysia. Malaysia has implemented MCO for 2 weeks since 18 March 2020. The result for the first phase of MCO is not satisfying. We can see from the table that all the number of new cases confirmed exceed hundreds daily. For the results from the 14 days, the number of new cases confirmed fluctuated wildly. But we can see that apart from the first 3 days of MCO, the number of new cases confirmed in the following days are high, especially on 23rd and 26th of March, with over 200 cases for both of the days. The government decided to prolong the period of MCO. Accumulatively, there are now 3 extensions and a total of 4 phases of MCO. The phase 2 of MCO started from the 1st of April to 14th of April, which is also the first extension. Then, the phase 3 started from 15th of April to 28th of April, the second extension. And finally, the phase 4 started from 29th of April to 12th of May, the third extension. Why are there 3 extensions needed? Significant answer will be, the residents are not following the rules of MCO, especially in phase 1 and phase 2, and they pay low consciousness and awareness on self-hygiene in this unusual time. Let's see the result of the first extension. The number of new cases confirmed are still not dropping to below hundreds, and sadly to say that there are still some days with extreme high number of new cases confirmed, such as the 2nd and 3rd of April and also the 11th of April. At the last day of phase 2, it still recorded at 170 new cases.
How to prevent as individual? The simplest way to protect us from the virus by wearing mask. First, N95. The N95 means the mask can filter at least 95% of the particles like bacteria, but they are not used by the general public. They're always used by the company or the government. Second, surgical mask. We also said face mask. Disposable device that creates a physical barrier between the mouth and nose of the wearer and potential contaminants in the imitate. Second way, reduce going out. First, going out 1 time for a week. We can see the people must line up and we have to take temperature in the picture on the right hand, and if the temperature above 37, we are not allowed to visit the supermarket. The market place restriction on the number of people, about 50, and one family can only send one family member to the market. Although the action control affect our life a lot, I think it's a good way to protect us from the virus and gathering people. Second, instead of hanging out with friends, we have to stay at home and we have many things to do. For example, we can review the knowledge we have learned. Also, we can watch the movie by using the laptop or the smartphone, or just reading books to kill the time or keeping in bed for good physical health. The third way, washing hands more often, cleaning your hands frequently. When you go upstairs or downstairs, you may press a button in the elevator, and you may touch the handlebar when you are taking a taxi. You will touch the goods in the supermarket because you have to stack them one by one. So we must use alcohol hand sanitizer after we touch things. The alcohol hand sanitizer will evaporate and kill most of the harmful substance in 1 minute. This is a picture I took after a big rain. Looking forward to the earlier end of the epidemic, and we will have a better life in summer.